If you've been hearing the term PMHNP everywhere lately and wondering what it actually means, what these providers do, and what their day looks like, and whether this could be the right career path for you, you're in the right place. Because here's the thing, psychiatric mental health nurse practitioners are one of the most in-demand healthcare providers in the country right now. And yet, most people, even nurses, who've been in the field for years, don't fully understand what the role involves, what the scope of practice looks like, or what actually happens during a typical day. So, in this video, I'm breaking it all down. What a PMHNP is, what they do, what they don't do, the setting they work in, and what a real day in this role looks like from start to finish. And if you're interested in becoming one yourself, make sure you stick around to the end because I have a free resource for you that maps out the entire journey. Let's get into it. A PMHNP, which stands for a Psychiatric Mental Health Nurse Practitioner, is an advanced practice registered nurse who specializes in mental health and psychiatric care. That means they are trained and licensed to assess patients for psychiatric conditions, diagnose mental health disorders, prescribe and manage psychiatric medications, provide therapy and psychoeducation, and monitor patients over time as part of an ongoing treatment relationship. Now, here's what makes PMHNPs unique compared to other healthcare providers in the mental health space. A psychiatrist is a physician. They went to medical school, completed a psychiatric residency, and have an MD or DO after their name. A PMHNP is a nurse practitioner. They started as registered nurses, went back to school for a graduate degree, and specialized in psychiatric mental health care. In many states, PMHNPs practice completely independently, meaning they don't need a supervising physician to prescribe, diagnose, or treat. They function as full autonomous psychiatric providers. And with a severe shortage of psychiatrists across the country, particularly in rural and underserved areas, PMHNPs are filling a critical gap in mental health care access. What does a PMHNP actually do? Let's talk about the clinical side of the role. What a PMHNP actually does day to day. Psychiatric evaluations. One of the core functions of a PMHNP is conducting comprehensive psychiatric evaluations. This is typically the first appointment a new patient has. It's a thorough assessment that covers the patient's psychiatric history, medical history, family history, social history, current symptoms, and mental status. It usually runs anywhere from 60 to 90 minutes depending on the setting. Medication management. PMHNPs prescribe and manage psychiatric medications. This includes antidepressants, antipsychotics, mood stabilizers, anxiolytics, stimulants for ADHD, and more. They monitor for side effects, adjust dosages, manage drug interactions, and make clinical decisions about when to add, change, or taper medications. Therapy and psychoeducation. Depending on their training and the setting they work in, many PMHNPs also incorporate therapeutic technique into their sessions. This might look like supportive therapy, motivational interviewing, cognitive behavioral techniques, or psychoeducation, which is helping patients understand their diagnoses and treatment plan. Ongoing follow-up. After the initial evaluation, PMHNPs see patients for follow-up appointments, typically ranging from 20 to 45 minutes, to monitor progress, adjust dosages, address concerns, and provide continuity of care. Documentation. Like any clinical provider, PMHNPs spend a significant portion of their time on documentation. This includes writing psychiatric notes, completing prior authorizations for medications, coordinating with other providers, and managing their patients' records. Where do PMHNPs work? One of the things I love most about the specialty is the variety of settings you can work in. PMHNPs are genuinely everywhere in the healthcare system. Outpatient private practices, where they can see patients in a clinic or an office setting for ongoing medication management and therapy. There's telehealth, one of the fastest growing areas right now. Many PMHNPs run fully remote practices, seeing patients from home via video. There's inpatient psychiatric units, which is working in hospital settings with acutely ill patients who need intensive stabilization. There's community mental health centers serving underserved populations, often with a sliding scale fee model. There's correctional facilities where PMHNPs provide psychiatric care within jails and prison systems. There's schools and universities, which are campus mental health settings where PMHNPs can see students. There's even integrated care settings, which are embedded within primary care practices to provide behavioral health support. There's also substance use treatment centers, where PMHNPs can manage dual diagnoses in patients with both psychiatric and addiction needs. The flexibility in this specialty is unmatched. You can shift between settings as your career evolves, go part-time, build your own practice, or work entirely remotely. Here's a day in the life. Now, let's get into what a typical day actually looks like. I'm going to walk you through a day in an outpatient telehealth practice because that's one of the most common and accessible settings for PMHNPs today. Let's start with 7 a.m. This is where you begin to prep your day. The day starts before the first patient. The PMHNP reviews their schedule, pulls up their charts, and reviews any messages or prescription refill requests that came in overnight. Maybe there was a prior authorization that needs to be completed for a patient's medication that gets flagged for the day. 8 a.m., you see your first patient typically. New evaluation. The first appointment is a new patient psychiatric evaluation. A 35-year-old presenting with symptoms of depression and anxiety, the PMHNP will conduct a thorough intake by reviewing symptoms, onset, triggers, past treatment history, family psychiatric history, current medications, substance use, and psychosocial stressors. A mental health status exam is also completed. By the end of this session, a preliminary diagnosis is established. A treatment plan is discussed, and a starting medication is prescribed. The patient typically leaves with a follow-up scheduled in 2 to 4 weeks. 9:30, follow-up appointments. The next several hours are filled with follow-up visits. Established patients coming in for medication checks. For example, a patient on an antidepressant for 3 months, you want to check how they're doing. Any side effects? Are they sleeping? Is the dose working? Adjustments are made where needed. Notes are documented between sessions. Noon, lunch break and/or admin time. During your lunch hour, this is your time to reset, but realistically, don't be surprised if during this time you're completing administration work, such as prior authorizations, sending referrals, following up on patient messages, meeting with drug reps, and addressing any urgent clinical tasks. 1 p.m., afternoon patients. The afternoon continues with a mix of follow-ups and possibly another new evaluation. For example, an established patient is being titrated off of a medication. Another is being started on a mood stabilizer and needs education about what to expect. A third is struggling and needs a safety assessment conducted. 4:30 p.m. This is where you do your end-of-day documentation. The last hour is dedicated to finishing notes, reviewing labs if any were ordered, completing any remaining administrative tasks, and preparing for the next day. And that's a day. It's clinically rich, mentally engaging, and genuinely meaningful work. No 2 days look exactly alike. And that's part of what makes the specialty so compelling. Why PMHNP? Before I wrap up, I want to speak to something that doesn't get talked about enough. The mental health crisis in this country is real. The demand for psychiatric providers is at an all-time high, and there simply aren't enough professionals to meet it. PMHNPs are stepping into that gap every single day in rural communities, underserved urban areas, schools, and living rooms through telehealth. This is a specialty where you can build a career that is financially strong, geographically flexible, and deeply impactful. Those three things don't often come together, but in psychiatric mental health nursing, they do. If this video got you thinking seriously about the PMHNP path, or if you're already on it and want a clear roadmap of every step from here to licensure, I put together a completely free guide called the PMHNP Blueprint. It's a quick guide to help you get started on your journey and a great resource to use. The link is in the description below. And if you found this video helpful, make sure you subscribe because we're just getting started. Coming up next on this channel, we're gonna walk through the complete step-by-step roadmap to becoming a PMHNP, so you won't wanna miss that. I'll see you in the next one.